introduction. Yes, I'm in line with the results Johannes Hebebrand represented, and I just wanted to start to give you some information on the consequences of school closures, because that's the point where we started in ESCAP together with other colleagues in Europe from the UMS to warn politics about the potential consequences. Then I will come back to mental health burden and quality of life. And of course, I will focus on child protection issues, as you said at the beginning in your first very kind introduction. And then I will come back to our policy efforts. So school closures. In April 2020, 1.6 billion pupils in 119 countries had been hit by school lockdowns. So this was a worldwide phenomenon. I will show you a map of the world. UNESCO calculates that school closures persisted in average for 22 weeks, and this corresponds to 2/3 of an academic year. And we now learn from newer studies that most pupils that had been trained online at home didn't learn so much during that year. And in March 2021, more than 120 million people worldwide had been infected with SARS-CoV-2, and more than 2.6 million people died. From a family perspective, that means there are many, many families in the world mourning. They lost family members. Children around the world were anxious to infect their grandparents, shied back from contact. And for example, in Germany, we have a study on the reduction of contact between the generations. And there's a strong reduction of contact and a concentration on the core family. This is that map that UNESCO published. And you see that the darker colors show shorter school closures, and the brighter colors show longer school closures. But you can see that throughout the world, there was a long phase of school closures, perhaps except to the Scandinavian countries and in parts to France. When we come back to the mental health burden and quality of life, at the beginning of the pandemic, we tried to make a narrative review on the literature we had on epidemic issues and economic crisis to have an idea about what will be the long-term effects of the pandemic. And I'm still proud that at that time, when many, many people talked about we will over that thing in 2 months during the summer, that we wrote at that time about the long return to normality. And we are still in that phase of a long return. And what we found is that Corona or other epidemic issues don't touch people in the same way. There is no common or general effect. Of course, we all feel exhausted, but there are some populations at risk that are hit much more than others. Our first huge policy paper was a paper published together with the UMS in Europe, and we just warned about the potential effects of social distancing measures and school lockdowns on child and adolescent mental health very early in March last year. We did one survey, and Johannes just told you that it's very difficult during the pandemic phase to do representative surveys. And we were lucky to have one representative survey for the German population in the field, with a part of the survey before the lockdown and another part of the survey during the lockdown. And with a hygiene concept, people could go to the families to get data. And what we can see here, and this paper is published now, is that the lockdown pleased some people. Some people in the age between 25 and 55 had, after the lockdown, a better quality of life and a better mental health situation. But especially younger people, so adolescents from the age of 14 up to 18, and young adults and older people showed a different pattern with more problems. And if you go to that CAMHS study that Johannes introduced, and I will skip that slide because you already have seen that data set from in another presentation, but I will go to this slide because the same group from Hamburg made another wave of that study, and we now have also data from December 22 to January 21. So we have the data before the crisis, and it's not just the same group as these two groups, as Johannes mentioned. But you can see, with respect to quality of life, low quality of life before the crisis was found in about 3 children out of 10. In the first phase of the pandemic, in the first lockdown phase in Germany, about in 6 of 10 children. And after 3/4 of a year of pandemic, around Christmas, in 7 of 10 children. And if we go to mental health problems measured by indicated by the SDQ, you see that the increase reported by Johannes Hebebrand for the first phase was quite stable, and they got the same results also around Christmas. The next slide shows you a study published in ESCAP journal, and when people asked families what they suffered the most during the pandemic, it was social distancing from family and friends, school closures, and childcare closures. So what I showed you in the beginning is really one of the main problems, that we have a restriction of contacts. And in the next slide, I will come to the child protection issues. The person that works for the Secretary General of the United Nations for Child Protection, Dr. Mjeed, a pediatrician, wrote an article, a commentary at the beginning of the pandemic on hidden scars and the impact of violence and the COVID-19 pandemic on children's mental health. And we opened an article series in Child and Adolescent Psychiatry and Mental Health, the official journal of IACAPAP, of the International Association of Child and Adolescent Psychiatry and Allied Professions. In Germany, we observed that networks in child protection collapsed during the first lockdown, and we had the same phenomenon during the second lockdown, because we in the hospitals could go on with our work, but child protection services and the Youth Welfare Office, in part, were not present, and there was no feedback in communication. We run a nationwide child protection hotline that you can reach 24/7. And in that hotline, you see we had a decrease during the first lockdown and a decrease during the second lockdown in Germany. And that's comparable to data from the US, where you also see a decrease at the moment where the lockdown hits. But if you look at the proportion of cases in emergency rooms, the proportion of child protection cases, that proportion increased. But in truth, we are still speculating whether there is a huge increase of child abuse, of conflicts in families, because we can't see the reality. It's in the dark field. And if we go to emergency room visits or to police data, we only get a certain spectrum. And at the moment, in many of these data sets, we see stable rates or even a reduction because the access to care was much more difficult. Only the statistics, the criminal statistics in Germany showed a huge increase in child sexual abuse cases, especially also in online-based grooming and things like that during the homeschooling phase. So let's come to policy. In our ESCAP policy section, we discussed on the internet, because we couldn't meet in person, about what that means for our future. And we thought that Europe does not only need an investment plan for industry, for tourism, and things like that, but we need a huge investment program for a next generation in Europe, because the economic investment program in Europe by the European Union was named Next Generation Europe. We took that title and asked for a recovery plan for children, adolescents, and their families. And we choose the word recovery plan because that was the original name of the Marshall Plan, the US Marshall Plan, called with the name of a US foreign minister who, after the Second World War, initiated a huge investment in Europe to reinstall democracy and a redevelopment of these societies in Europe. And if we take these issues, we said in our paper that we need differentiated investments in children. And I'm also the head of the German Family Council, Scientific Council of Family Affairs to the German government. And we took the same issues from our policy paper to German politics, because at that time, the government decided to give every family about 100 euros. So this is a gesture that costs billions of euros, but brings no relief to those who really need special help. And therefore, we said we have to identify and address special needs. Family policy must improve digital offers in many areas, because digital approaches were new at that time and can be helpful. But we really have to focus on groups in need, like children with mental health problems. I was proud that the German government reacted. We published that paper in March after the discussion with our Minister of Family Affairs. And then we had an action program published in May with 2 billion euro for school training to catch up with all these things children missed in schools, but also with a lot of social work offers and school social work. This might be only a drop, because we see, as Johannes said, separation anxiety, social phobia, consequences of cybermobbing, online grooming, school avoidance, the whole complex of anxiety and depression, eating disorders. We have increased reports on child abuse and neglect, and expect even more when children come back to schools. And another thing that we see is a lot of problems in transition phases. So from kindergarten to school, from school to secondary education. And we see in adolescence, where the transition to adulthood is especially difficult in this phase, a lot of self-harm and also suicidality. So I think we need a stepped care approach that addresses the problem in the whole population, but also has selective and indicated responses for special indications in different populations. And if you follow me, I think we need a pyramid that goes from mental health interventions up to specialized treatment in mental illness. And we see a very broad increase in global mental health problems, but we also have an increase in the treatment need in inpatient units. And we have to address this on different levels, and therefore we have to be selective in our offers. And this is a problem for the whole European Union, how to tailor a good response to that situation, because at the moment, especially that the families that look for help see us. But many children are only seen in schools, and then teachers advise parents to go to a child psychiatrist. And therefore, I think we have to be in narrow contact with other professions. I thank you very much for your attention, and I always close with the citation of Albert Einstein, because he comes from Ulm, and he said, there are no great discoveries as long as there is still one unhappy child on Earth, and at the moment we have quite a lot of unhappy children on Earth. Thank you very much.